Congratulations!
Nigeria on the podium in Abu Dhabi wins Zayed Sustainability Prize for innovative technology in food production.
We have a unique opportunity to strengthen our democracy.
National Assembly resumes plenary sessions. Committee on Information and National Orientation wants sector's 2025 budget proposal increased.
When it comes to the issue of death of women, we are committed to accelerate.
Plus, a look at federal government's free emergency cesarean sections. Good evening, and nice to have you join us on the Network News on NTA. I am Elizabeth Omori. Tonight, our busy businessman, Benny Adams, will bring us the latest in the world of business. Benny?
Well, on business is cheering news for investors in Nigeria as the African Development Bank has facilitated $7.6 billion for investment out of about 29.2 billion facilitated for the whole of Africa. We'll give you details during the bulletin. That's
good to know. Bade Adeleye has the thrills of the field. Bade.
Many thanks, Elizabeth. CHAN 2024 has been postponed again. We have to wait for another 7 months. We'll bring you details in the sports segment.
We're on the lookout. Don't forget to follow us live on our website, nt.ng/live, NT News on X, as well as other social handles displayed on the screen. Now the news. The 2025 Abu Dhabi Sustainability Week has officially opened in the United Arab Emirates capital with the Zayed Sustainability Prize. State House correspondent Musbaut Danwahab reports that a Nigerian company is one of the award recipients in the 17th edition of the prize, winning $1 million for its innovative technology in food production.
The government of the United Arab Emirates invites world leaders to this stage to assess the state of sustainability efforts. President Bola Tinubu is one of the 13 leaders invited from across the world. The Emirates have been living an incredible story of turning a desert to a fertile land, and the country is now leading a direction of new possibilities, setting the pace in renewable energy and other sustainability measures.
I am pleased to announce the launch of the world's first renewable energy facility capable of providing renewable energy at scale around the clock. The nexus of next means putting people at the heart of progress. It means uniting to address global challenges. And it means recognizing that no discovery is worth making unless it helps humanity and improves lives. And that is the Zayed Sustainability Prize. And that is what the prize is all about.
Championing the cause of protecting the earth and empowering people for a sustainable future, the government of UAE is also spreading its tentacles through the Zayed Sustainability Prize, recognizing and supporting outstanding bodies in this direction. And then, a proud moment for Nigeria, and indeed the president, as a Nigerian company won a prize in food production out of the 6 major categories of the prizes.
And the winner is Nafarm Foods. Congratulations!
So we make hybrid solar food dryers for drying food, fruits, vegetables. We also support other cottage food processors, which is the center, that's the core of our business.
Nafarm Foods is based in Kaduna State with operations currently in 6 northern states.
So with this award, we believe we are going to reach 16 other states soon. And it will really go a long way.
Our winners today, changing the world.
The summit continues with other events, including high-level sessions of world leaders. In Abu Dhabi, Musbal and Wahab, NTA News.
And back home, Senate has reconvened plenary after the Christmas and New Year break with renewed commitment to collaborate with the executive for overall development. The sitting commenced with confirmation of appointees of President Tinubu into the board and management of the South, East and Northwest Development Commissions. President of the Senate, Godswill Akpabio, assured Nigerians that the Red Chamber will work meticulously on the 2025 budget proposal under consideration with the usual patriotic zeal. He also disclosed plans to further amend the Electoral Act.
As the nation begins preparations for the next electoral cycle in 2027, we have a unique opportunity to strengthen our democracy by tinkering with our Electoral Act, to strengthen it for the congresses, primaries, etc., and conventions. Electoral reform is not just a legislative duty, it is a moral imperative.
National Assembly correspondent Lami Ali reports that Senate in the meantime adjourned plenary for another 2 weeks to resume Tuesday, 28th of January 2025 to enable standing committees continue budget defense engagements with MDAs. Meanwhile, passage of the 2025 appropriation bill and the tax reform bills before Parliament have been listed as priorities as the House of Representatives resumed plenary after the Yuletide. The House is also advocating increased funding, provision of modern equipment and enhanced welfare packages for the armed forces of Nigeria. National Assembly correspondent Mitari Ikmen brings us details.
Crucial bills are before lawmakers as they resume plenary to tackle socio-economic challenges through legislation.
The resumption.
The Speaker's address delivered by the Deputy Speaker sets the tone for legislative business.
Our legislative agenda for 2025 prioritizes the passage of the appropriation bill and the tax reform bills, both of which are pivotal to economic recovery and fiscal stability. These reforms are essential, broadening the tax base, improving compliance, and reducing dependency on external borrowing.
While commemorating Armed Forces Remembrance Day, the House is unanimous in a resolution that the nation's military deserve more funding and benefits.
Calls on the relevant committees of the House to regularly assess and provide recommendations for the improvement of the armed forces operations, ensuring their continued efficiency and effectiveness.
An offer of automatic scholarship through basic, senior secondary and tertiary education for the children of our fallen heroes, so that this will motivate the forces to do better while in their line of duty.
To curb the spread of various strains of hepatitis, lawmakers are pushing for increased awareness and testing for the virus.
To urge the Federal Minister of Health and Social Development and the relevant agencies to make testing, vaccination and treatment mandatory for children below 5 years of age to prevent mother-to-child transmission, ensure safety standards are adhered to both in public and private healthcare facilities in the country towards containment and prevention of further spread of viral hepatitis.
At the Committee of the Whole, the House adopted the report of the Conference Committee which harmonized the Southwest Development Commission Bill for presidential assent.
Today is the final that the House has just passed, and which means that it will be transmitted by the clerk to the National Assembly straight to the President for his assent. And once that is done, Southwest Development Commission has come to stay.
The House has adjourned plenary for 2 weeks till the 28th of January 2025 to enable lawmakers intensify scrutiny of sectoral allocations in the 2025 budget. From the National Assembly, Mitari Ikwen, NTA News.
Considering the place of information management in promoting policies and programs of government, the National Assembly has rejected the Ministry of Information and National Orientation's 2025 budget proposal, describing it as inadequate. The legislators sought special intervention to support the ministry and its agencies in discharging their duties. Details of this report will come in the course of the bulletin. Still on budget defense, the Joint Admissions and Matriculations Board, JAMB, has clarified that it did not present a budget performance for 2024 during its recent appearance before the Joint Committee on Finance of both the Senate and House of Representatives. The board presented its 2025 budget proposal, according to its registrar, Professor Ishak Oloyede. Addressing journalists on the matter, Professor Oloyede dismissed allegations of excessive spending in 2024, particularly on items such as meals, fumigation, security, and cleaning. He described such claims as baseless. The registrar explained that in line with policies of government on outsourcing, JAMB has contracted reputable firms to provide essential services. These include 386 security personnel and 194 cleaners deployed across its over 40 offices and computer-based test centers nationwide.
All offices in 2024 not up to 1 million. And what we budgeted for 2025 for fumigation is less than 2 million. There are security reasons for not allowing people going in and coming out. You also know that we have some ICT infrastructure that will be damaged if we allow people to be bringing food and remnant. So we created a canteen and we provide for them.
So Oloyede also spoke on the 6.4 billion naira allocation for local travels and transportation for trainings in the proposed 2025 budget. He noted that the funds are earmarked to facilitate activities of more than 10,500 staff and officials involved in conducting the 2025 Unified Tertiary Matriculation Examination.
Their DTA. It's the government that determines the DTA to be paid to them. So what offense have I committed in putting their claims together? And that was 3.2 billion of the 6 billion, 6.4 billion.
JAMB reaffirms its commitment to the prudent management of resources and assured Nigerians that its operations and expenditures align with the nation's leadership expectations and fiscal accountability. Now, a report on the Minister of Information's appearance at the National Assembly for Defense Budget is now ready.
Presenting the budget of the Ministry of 8.9 billion naira for 2025, alongside agencies under its supervision, Minister of Information and National Orientation, Mohammed Idris, highlighted the 2024 budget performance.
Reforms have been happening since last year, and most of those reforms we believe will be consolidated in 2025. Now, if that is going to be achieved, it is important that Nigerians, and especially our representatives here, pay attention to what happens in this sector. It is our job to tell Nigerians what every ministry, what every agency is doing. Of course, they have the responsibility to also, dance to their own music, but it is our job generally to put that forward. I will take you through some of the things that we have done last year. First, that we instituted, or rather we continued, not instituted, we continued what we call the regular ministerial press briefings and conferences. In the course of the preceding year, about 25 ministers have appeared at the National Press Center to tell Nigerians about what they do. Some of them, of course, have been doing that at their various ministries and offices and elsewhere. But we find it necessary that all of them come to the National Press Center to tell Nigerians, because this is the biggest press center that we have in this country. We invite every minister, every head of agency to come with his minister to come and tell Nigerians what he or she is doing so that Nigerians can get to know what happens in his own ministry. So we have, so far taken about 25 of these ministers, and we are also going to continue this January. Very soon we are going to have the ministers of petroleum, ministers of state petroleum, minister of state oil, gas, and the managing director of NNPC to also tell Nigerians they are the next in the line, and then subsequently we also have other ministers coming.
Mohammed Idris says the ministry will continue to inform Nigerians on what government is doing for value orientation.
We need to have value reorientation for our people so that whatever we set out to do as a nation, can be achieved, no matter which the roads that we build, no matter the hospitals that we build, no matter whatever the engagement that we do. If this value reorientation is not in the front burner, it will not see the light of the day. And so we thank Mr. President for seeing that and for also ensuring that this ministry takes a center stage.
Members of the committee commended the giant strides made by agencies under the Ministry of Information, particularly the NTA, committing them to increase their revenue generation.
It's really, really worrisome that an average young Nigerian today believes that the quick way to make money is through rituals, or should I say Yahoo Yahoo. So it's also up to your ministry to see how you can devise a means to reorientate our people on the values of living, on the values of humanity, the values of self-worth, and a whole lot. Let me say this. I was searching now on how much certain African countries spend on orientating their people, how to disseminate information, and again, build a national image. Let's take South Africa, for example. South Africa's budget in 2024 for a ministry similar to yours, which is called the Government Communication and Information, the budget 5.1 billion rand, equivalent is 409 billion naira. So if South Africa is budgeting 409 billion, Nigeria should be talking about 1 trillion, 1.5 trillion, because they say information or news shapes the mind of people.
I support the position that information is power, and the more we market our country, the safer we are as a democracy. So every consideration should be given to this sector.
When I see this kind of figures for Federal Ministry of Information, it's no fault of yours. Somewhere we're missing the point. Because if you take what the government pays into channels, into Arise, into several stations, and we see those people who come and defend the government, and it means a lot of money. We know it's a lot of money, but the government own is being sidelined for whatever purpose, I don't know. Either it's systemic, it's not about Bola, President Bola, it's systemic. And that's why this committee needs to up its ante. What do? Try to make sure that the NTA and other television stations remain competitive. Imagine the revenues that you have. Throughout there, less than 200 million. In fact, 156 million. That's revenue. Imagine your overheads, 3 billion. Imagine your personnel, 3 billion. Imagine your capital, less than 7 billion. And when Senator Natasha was saying, do this, do that, the question is, with what money? With which money? Where would they get the money?
All the comments and commendations that have been clearly stated here, as mine too, and not to repeat them. Now, Senator Samson Ekong touched on an issue about the IGR, and that will be my first port of call. Item number 6 at page 7, which is Federal Tenders Journal. That is a journal that tells the public available contracts for which they tender and make money from. And I think the cost of that journal is too low.
So what we propose to do this year is to reject this budget. You go back to the president, considering the level of activity we expect from you and the deliverables that are required. We are moving this motion that the budget for the Ministry of Information and National Orientation is rejected by this Committee on Information. I so moved.
Chairman of the Senate Committee on Information and National Orientation thereafter speaks on the budget proposals.
And we observe the very insignificant and minimal appropriation for the entire ministry. And considering the fact and the role that the information sector play in this country, And we are saying we want to drive the transformative agenda of Mr. President. We deemed it necessary last year to recommend to the Appropriation Committee that there's every need for the information sector to be well funded. And in doing that, by the end of the day, we couldn't get the expected result. And this year, the ministry appeared before the committee again, and they came with the same, even lower appropriation for the information sector and all the agencies. And as National Assembly and Senate in particular, and very responsive body like lawmakers, we feel it is not proper and not acceptable for us to legislate on that proposal that was brought to us. So the Senate Committee on Information and National Orientation unanimously resolved that this budget be returned back so that the expected result will be achieved.
The budget defense was adjourned sine die. From the National Assembly, Muhammad Rabiu Ali, NTA News.
Away from budget defense, the federal government is engaging the nation's agricultural institutions towards improving the agri-sector to address food insecurity and other challenges in the sector. Minister of Agriculture and Food Security, Abubakar Kyari, stated this while briefing State House correspondents on the prospect of the ministry in the year 2025. State House correspondent Abdurrahman Jibrila brings us details.
The 2,000 tractors from Belarus have started arriving in Nigeria. Very soon, as soon as we finish the delivery and assembling, we're going to launch the tractors for onward distribution to our respective farmers.
This is part of the game-changing role of the Renewed Hope Agenda for the nation's accelerated implementation plan to actualize its food security agenda.
So we're looking at other additional funding. We're trying to discuss with the private sector to support especially the youth that are very vibrant to take advantage of our mechanization program and all the other good things that will come with it, the harvesting, the drone facilities, and also fertilizer inputs and other inputs. It's very important to also educate our farmers that agriculture is no longer for the stomach only. It should be also be seen as a way of business.
In the year 2025, more attention will be given to wheat and rice production with private sector support, technological transformation, mechanization, among others.
We have concluded all the interventions in the first part of the dry season of 2024-2025 by the wheat phase 1. That was concluded by December 27th, 2024, where we supported 150,000 hectares, and that amounts to about 300,000 farmers, which is one farmer per half a hectare. And the support we gave was subsidy of seeds, wheat seeds, to the tune of 75%. So what we're saying is that the farmer pays 25% and the government pays 75% of the seed amount.
The government is also reorganizing the Bank of Agriculture to support public financing and strengthen bond with development partners, particularly the Africa Development Bank groups. From the State House, Abdurrahman Jibrila, NTA News.
This is Africa's largest TV network, the NTA. Healthcare in focus when we return after this break. To stay with us. You're still watching the network news on NTA. Effective and qualitative healthcare service delivery to all Nigerians is one of the cardinal objectives of the present administration. Minister of State for Health and Social Welfare, Isaac Adekunle Salako, made the assertion as he took stock of some agencies under his office. Mojanatu Adam Said reports.
Challenges of battling non-communicable diseases as well as some terminal diseases is still an issue in developing countries like Nigeria. Hence, the resolve to ensure qualitative health care for all Nigerians in fulfillment of promises made by the present administration. When achieved, the minister believes will cut down on medical tourism.
Manufacturers and colleagues. So I'm sure you realize that during COVID, you had more people who were producing sanitizers, and that went a long way in ensuring that Nigeria controlled COVID-19 in the way it did.
We are excited to highlight two significant projects: the new clinical services building, this, and ward extension, which is about 64 bedded. We offer advanced medical services such as routinely we do open heart surgeries, spine and neurosurgical operations.
Stakeholders in the Nigerian project commit to ensuring government succeeds in its plans.
So we believe that for us as ministers and for all the agencies, all the workers, we must work very hard to justify the confidence that Mr. President is reposing in the health sector.
Another concern of stakeholders is the need to invest in prevention rather than cure. In Abuja, Marjanatu Adam Said, NTA News.
Still talking health, the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, says President Bola Tinubu has approved the mass recruitment of young Nigerians to serve as accountability officers who will monitor the construction and operations of 8,800 new primary health centers nationwide. The Coordinating Minister stated this at a capacity building workshop for state desk officers under the sector-wide approach program, SWAP, for office in Abuja.
Very impressive. So it's a proxy of health system performance if we're able to improve the services, particularly for the poorest and most vulnerable populations. And that idea requires us to act, to think differently.
The SWAP is an approach, so there are expectations around coordinating stakeholders at the state level so that performance management monthly meetings can happen that build up to our quarterly discussions with states. There are expectations around resource convergence, so visibility of spending and ensuring that it aligns with our priorities.
Young Nigerians to monitor and ensure the integrity of all health centers they are assigned to, underscoring the importance of the SWAP framework. Do you know that a woman dies of pregnancy-related causes every 2 minutes globally, even when most of these deaths are preventable if the right care is provided at the right time? The Nigerian government has been prioritizing an end to maternal mortality. The latest of such initiatives is the free emergency cesarean sections for indigent women, tagged Supporting Financial Access to Comprehensive Emergency Obstetric and Neonatal Care, driven by the National Health Insurance Authority. Olusheye Adiagbo tells us more about this initiative.
Nigeria is ranked third in the world in maternal mortality rate, recording 1,047 deaths per 100,000 births, and in 2023 alone, about 100,000 women lost their lives during birth and after birth implications across different parts of the country.
Well, I visited primary health care when I was pregnant. At the time they noticed my child was not properly stable in the womb, I think, or I was expecting, they should be able to inform me, but nothing. They just told me it's malaria. And although I lost the child, but
Cynthia Anthony is alive to tell the story of her stillbirth experience, but many cannot.
When it comes to the issue of death of women, we are committed to accelerate improvement of the health of women and children and reduce maternal death to the barest minimum. In fact, zero tolerance to maternal death is what we are promoting in this administration.
Lack of access to cesareans is also thought to be among the reasons for maternal mortality. However, the supporting financial access to comprehensive emergency, obstetric and neonatal care, a recent federal government initiative, is already working in country. Dr. Phillips Epe, a consultant gynecologist and obstetrician with more than 2 decades experience, unequivocally agreed that the initiative is encouraging.
NHIS have to first of all also take statistics, considering all the public hospitals that take care of pregnant women, then also look at possibly the private hospitals, considering the fact that the public hospitals are only caring for less than 30% of pregnant women in this country. What happens to the other 70%?
The concern is on the need to enhance the level of coverage, strengthening sensitization in communities, and with achievable sustainability plans. In Abuja, Olusheye Adiagbo, NTA News.
And joining us in the studio now is Dr. Kelechi Ohiri, Director General, National Health Insurance Authority, to speak more on the initiative. Dr. Ohiri, thank you so much for joining us on the news.
Good evening, and thank you very much for having me.
Thank you so much. Now, tell us more about the National Free C-Section Program, and what is the current state of the program?
And thank you very much. And again, it's a pleasure to be here and to be able to tell you about this excellent initiative. The NHIA is aimed at enhancing financial access to healthcare, and this helps us reduce health poverty, where those who are poor and can't afford healthcare will have access to it, and those who have access to it and will otherwise have been plunged into poverty can actually get some reprieve. As part of the Coordinating Minister for Health and Social Welfare-led Health Sector Renewal Investment Initiative, a priority is to crush maternal mortality and actually have zero tolerance for it. And we know that there are many ways to do that. And from the NHI's perspective, one of the things we're doing is to enhance financial access to comprehensive emergency obstetric care, so that any woman that has an obstetric complication is neither turned away nor denied care because they cannot afford it. And so this program has 3 approaches to it. The first is that when a woman presents in labor with a complication, that's not the time to start asking whether she can afford it or whether she has insurance coverage. So we address the complication, which is probably one of the 5 leading complications of maternal death. Then after the resolution, we provide other services and then ensure that this woman is enrolled in a health insurance scheme so that subsequently any subsequent pregnancy is covered, because emergency obstetric care, including cesarean sections, are part of the benefit package.
Okay, Dr. Ohiri, recently the Coordinating Minister of Health announced that there was a record-breaking rate of health insurance enrollment in 2024. What accounted for this, from your explanation?
Thank you very much. NHS has recorded a lot of encouraging results. And one of the reasons why we've had such an upsurge in expanding insurance coverage was, one, the fact that there is more awareness and more communication. Secondly, every state in Nigeria now has a social health insurance scheme, and we've been partnering with the states to expand that. More funding consistently has been provided to cover the vulnerable. So not only do we have the formal sector covered, we also have the informal sector and the vulnerable populations covered. In addition, other programs that we've expanded, such as the obstetric fistula program, where over 1,600 women have received treatment for obstetric fistula and been enrolled in insurance. The same thing applies to the maternal mortality reduction initiative. And so 3 things are driving this. 1, awareness. Secondly, more trust, because we're working closely with all the stakeholders to ensure that more people are covered. And the 3rd one will be to ensure that it is more mandatory and more people actually enroll in health insurance program across board.
Okay. We also understand that the federal government is also offering VVF repair in facilities across the country. How true is this, and how is the program assessed?
This is very true. And as you know, fistula is one of the obstetric complications that arise. And right now, about 22 referral facilities all over the country are participating in the program. About 1,800 women have already had fistula surgeries concluded and paid for by the NHIA. And the program has been expanding across the country. And so that is actually a program that we're very proud of because it does address problems that people who are extremely vulnerable are susceptible to. And that complements the program that we are operating with the access to comprehensive obstetric emergency care. So those programs are going very well, and we are scaling up nationally. And one more thing, whereas in many cases we've started with public facilities, but we're not limited to that. We're also bringing in high-volume private facilities and allowing ourselves to be data-driven, where we have identified where are women going to and having a lot of deliveries, and where are women dying. And we've prioritized these facilities as the places to start and ensure that that delay that comes from not having money stops being a problem and a barrier to accessing care. And from there, we will go to high-volume facilities. And we've also written and are working with all the states so that we step down to secondary care facilities where women also go to for childbirth. And I think this is a program that will have a national scale. We have seen encouraging results in growth in a number of people who have availed themselves of this opportunity. And we are sure that at this pace, we'll have national coverage very soon.
It means our women are covered.
Our women are covered.
Of course. Dr. Kelechi Ohiri, Director General, National Health Insurance Authority, thank you so much for joining us on the Network News. Thank you very much.
Thank you very much for having me once again.
Thank you. To other news, Nigeria's First Lady Oluremi Tinubu has received the new Permanent Secretary, State House, Temitope Fashidemi, at her office in the villa. The meeting, held behind closed doors, is to enable the new Permanent Secretary acquaint himself with intervention programs of the First Lady towards smooth delivery for the benefit of women, youths and vulnerable groups in the country. After the closed-door meeting, the Permanent Secretary expressed his readiness to establish needed frameworks to support both the President and the First Lady in their renewed hope agenda.
So it's whatever intervention she's, even I'm coming from Federal Ministry of Agriculture and Food Security. Even there in agriculture, she has projects that she's doing all over the country, where we have been instrumental in supporting that as well. So even in agri, and she has projects all over the place. So now in State House is for me to facilitate, her movement and movement of our team in achieving all these projects to ensure that there's efficient delivery of services.
It's time to take another break, and when we return, we will be talking business with our very own busy businessman. Stay with us.
Now talking business. Nigeria, led by Lagos, Kaduna, Katsina, Kwara, Plateau and Ogun states, has secured a total of 7.6 billion investment commitments at the African Investment Forum hosted by the African Development Bank. This is as the forum facilitated $29.2 billion in total investment interest for various projects across Africa, ranging from energy and infrastructure to agriculture and technology.
Africa, ladies and gentlemen, presents such a unique investment opportunity which cannot be ignored. Don't just believe me, believe the data. The New York Times said recently, the world is becoming more African, as 1 out of 4 people in the world by 2050 will be African. The size of Africa's food and agriculture market will rise to $1 trillion by 2030. Demand for infrastructure presents an annual investment opportunity of at least $170 billion a year, from energy, transport, digital infrastructure, water and sanitation, and many more. Your presence here today shows that you see the investment opportunities for value creation in Africa. Again, believe the data.
Come to Kaduna State and see the comparative advantage we have with regards to agriculture.
Now, the Nigeria Customs Service has announced the generation of more than 6.1 trillion naira for 2024. Kunle Adeyeye reports that Comptroller General of the Service, Adewale Adeniyi, in a news conference emphasized that the agency surpassed its revenue target of 5.07 trillion naira by 22%.
During this year, we collected a total sum of 6 trillion 105 billion 315 million 543,489 naira 50 kobo. This performance surpassed our target of 5.079 trillion by 1 trillion.
Now, looking at the stock market, Africa gets new stock market as Ethiopia woos investors. The market is set to begin trading on Friday after a 5-decade gap. While we await Friday's opening gong, let's see the numbers from other African countries. As Nigerian investors lost 1.06 trillion naira, the highest in a long while, with markets closing at 63.19 trillion naira. Guarantee Trust was the most traded stock by volume and value, with 54.35 million units traded, worth 3.15 billion naira. On the aggregate, 125 companies participated in trading, ending with 23 gainers and 41 losers. And looking at South Africa, Tunisia, as well as Namibia, it's been a mixed grill. Nigeria going down, talking about 1.66%, and in Namibia overall index 0.49%. But for South Africa and Tunisia, it's been 0.20% increase and 0.61%, which is to say Africa is doing great at this time. Well, this is it on our business. Elizabeth, you can take it from here.
Thank you so much, Benny. The Borno State government has approved free cataract surgeries for 10,000 patients as part of efforts to address the health challenges in the state. Governor Babagana Umar Zulum announced the approval while flagging off surgeries for 1,000 patients, an initiative facilitated by Senator Mohammed Ali Undume, representing Southern Borno, with support from the state government. Mohammed Goni reports.
I've been suffering from this ailment for the past 2 years. I'm grateful to you.
Maurice Zawama is one of the 304 beneficiaries in the first phase of the cataract surgery program being conducted at 4 designated hospitals across the metropolis. The mass-free eye surgery is a collaborative effort involving the Borno State government, Senator Ali Ndume, Nigerians in diaspora, and Saudi philanthropists. The program, which targets to provide free surgeries for 1,000 patients, has already screened 1,457 individuals who turned up for the operations. Governor Zulum, who was briefed on the process by the Health Commissioner, Professor Baba Malam Gana, and the Medical Director of the Eye Hospital, Dr. Yagana Kyari, assured that no one will be left out.
And then because of what I have seen, I have now told them that we should not stop at 1,000 only. We shall extend the numbers of people that will benefit from this scheme up to 10,000.
The surgeries will be conducted in Biu and Mongono Eye Hospitals, with each attending to 3,000 patients, while Maiduguri Eye Hospital will cater for 4,000 patients. The governor also announced that each patient who undergoes surgery will receive 50,000 naira, while all categories of workers involved in the surgeries will receive 100,000 naira each.
We started the first one in 2007. And then we have been doing that annually. We did 3 times. Then, unfortunately, we are confronted with this insurgency problem.
Senator Ndume praised Governor Zulum for extending the initiative to cover 10,000 patients, describing it as a groundbreaking achievement. In Maiduguri, Mohammed Goni, NTA News.
Badi Adeleye will be up with sports updates after this break. Stay with us.
At home.
Time to talk sports on the network news tonight, as the chairman of the House Committee on Sports, Kabir Amadu, has commended President Bola Ahmed Tinubu for significantly increasing the 2025 budget for sports sector from 29 billion in the year 2024 to over 94 billion naira in 2025. Amadu made this remark on Tuesday during the budget defense session of the National Sports Commission, the Nigeria Football Federation, and the National Institute for Sports before the committee at the National Assembly.
money is never enough in sports. There's always something to be done with sport, but at least Mr. President and the government have shown their skill by first taking the first step by making the clear budget. That's the departure from what we see in the past.
I hereby implore you to justify the confidence imposed on you by Mr. President, Bola Ahmed Tinubu, and the Nigerians by deploying your wealth of experience in ensuring optimal utilization of the allocations in the 2025 budget when approved and passed by the National Assembly.
Now, the curtain raiser of the 2024-2025 Nigeria Women's Football League Premiership season between defending champions Edo Queens and Abia Angels will be live on NTA Sports on Channel 270 on Star Times this Wednesday. Studio opens at 5:30 in the evening. And of course, let's let you know that CAF has now postponed the 2024 CHAN to August 2025. That's a bit on sports. Let's return to Elizabeth.
Thank you for the updates, Bade. And that's the news tonight. Thank you so much for your time. I'm Elizabeth Omori.